Hello everyone, it's Dr. Locklear here, and I'm coming to you today with the concept of inflammation. This is Module 10 on page 669 of your Pearson text. And what are our learning outcomes for the day? We want to analyze the physiology of inflammation. So how does inflammation occur? What are the alterations in inflammation? What's the relationship between inflammation and other concepts? Explain the promotion of a healthy inflammatory response, because it can be healthy because that's the body's way of healing itself. Differentiate common assessment procedures and tests used to examine inflammation. When you do your head-to-toe assessment, you need to look for signs and symptoms of swelling and inflamed areas like redness and heat and warm to touch. Analyze independent interventions nurses can implement for patients with inflammation. What do we need to do for these patients? What do they need to help resolve this issue? Summarize the collaborative therapies used by the interprofessional teams for patients with inflammation. Who all has a part of this? What are the things that we do as we work together to provide care? Differentiate considerations related to the assessment and care of patients with inflammation throughout the lifespan. So when you do a head-to-toe assessment, you need to make sure and pay close attention to the skin and to these areas that look like they have some type of inflammation going on, and document it and report it. So what is normal inflammation? Inflammation is a non-specific but complex response to reduce the effects of what the body sees as harmful. So the body is fighting against whatever's causing the inflammation. It's going to have an attack on it, so to speak. Inflammation may result from an injury such as an ankle sprain or from an underlying infection. Autoimmune disorders frequently cause inflammation sufficient to result in tissue damage. Other harmful agents include pathogens, damaged cells, and irritants such as cigarette smoke. Under normal circumstances, inflammation acts as a protective process that stimulates healing and prevents further damage or progressive deterioration. The occasional uncomfortable symptoms of normal inflammation usually resolve with successful palliative care. And we know as the area gets inflamed, it is very uncomfortable as the tissue starts to stretch and swell. The inflammatory process can escalate and lead to complications such as autoimmune disorders, rheumatoid arthritis, psoriasis, asthma, and allergies. These conditions may require more aggressive care that includes pharmacological therapy. So what do we see in the normal presentation? Inflammation is an adaptive response to injury or illness that brings fluid or plasma, dissolved substances, and blood cells into the interstitial tissues where the invasion or damage has occurred. This innate immune response is nonspecific because the same events occur regardless of the cause of inflammatory process. So regardless of what's causing it, this same process is going to occur. Through the inflammatory reaction, the invader is neutralized and eliminated. So the body's immune system fights against it to get rid of it. The destroyed tissue is removed and the process of healing and repair begins. Inflammation is the first phase of the healing process. During the inflammatory process, particular matter, bacteria, damaged cells, and inflammatory exudate are removed through phagocytosis, and a large number of potentially damaging chemicals and microorganisms may be neutralized. This process, called debridement, prepares the wound for healing. Adequate nutrition is essential for inflammation and healing to proceed. So you're going to have a natural debridement going on. Inflammation is characterized by 5 signs, and we call these the focus for you to look at. You need to look at these 5 areas here. Pain, swelling, redness, heat, impaired function of the body part if the injury is severe. Words with the suffix itis typically describe an inflammatory process. For example, appendicitis, and we'll talk about that in exemplar 10A, means inflammation of the appendix. Gastritis means inflammation of the stomach. Injurious agents can be categorized as physical agents, chemical agents, and microorganisms. Physical agents include mechanical objects causing trauma to tissues, excessive heat or cold, and radiation. Chemical agents include external irritants, strong acids, alkalis, poisons, irritating gases, and internal irritants, substances manufactured within the body, such as excessive hydrochloric acid in the stomach. Microorganisms that can cause inflammation are bacteria and viruses. So a lot of things can lead to inflammation. So what is the inflammatory process? Inflammation is a complex response of vascular tissues that is triggered by harmful stimuli. So something is foreign or abnormal to the body. By isolating the damaged area and promoting repair of the surrounding tissues, the inflammatory response protects the body. So in other words, the immune system is going to kick in. It's going to cause this inflammatory response to neutralize this irritating bacteria or microorganism. By isolating the damaged area and promoting repair of the surrounding tissue, the inflammatory response protects the body. Without this necessary and beneficial process, wounds and infections would never heal. Inflammation may be classified as either acute or chronic. During an acute inflammation, the inflammatory response may occur within minutes of an injury, such as a splinter or an insect bite. On the other hand, a response to bacterial infection may take a few hours. During the acute inflammatory response, the typical signs of inflammation are redness, swelling, pain, heat, and impaired function. The acute process continues until the trauma or infection is neutralized. When the acute inflammatory response is unable to neutralize the harmful stimuli, the response may become chronic, continuing for months or years. Chronic inflammation ranges from seasonal allergic reactions to pollen to responses that damage healthy tissue in the autoimmune diseases such as rheumatoid or like Hashimoto's or some of your thyroid issues. So what are the stages? There are 3 stages: vascular and cellular responses, exudate production, and repair. So stage 1. Immediately after injury or infection, blood vessels temporarily constrict in the surrounding area. The injured tissues release histamine, kinins, and prostaglandins in response to the injury or infection. These substances serve as chemical mediators to dilate blood vessels, causing more blood to flow to the injured areas. And the more blood brings more oxygen and more nutrients that the cells need. This marked increase in blood supply is referred to as hyperemia and is responsible for the characteristic signs of redness and heat that accompany inflammation. Vascular permeability increases at the site with dilation of the vessels. So the vessels dilate, trying to get more blood. Fluids, proteins, and leukocytes, these are white blood cells or WBCs, leak into the interstitial spaces, causing inflammation, swelling, edema, and pain. Pain is caused by the pressure of accumulating fluid on nerve endings and the irritating chemical mediators. Fluid pouring into areas such as the pleural or pericardial cavity can seriously affect organ function. In other areas such as joints, accumulating fluid impairs mobility. Slow blood flow in the dilated vessels allows more leukocytes to arrive at the injured tissues. The leukocytes aggregate or line up along the inner surface of the blood vessels. This process is known as margination. Leukocytes then move through the blood vessel wall into the affected tissue spaces, a process called immigration. In response to the exit of leukocytes from the blood, the bone marrow produces more leukocytes in even larger numbers and releases them into the bloodstream. This process is called leukocytosis. A normal leukocyte count of 4,500 to 10,000 per cubic millimeter of blood can increase to 20,000 or more when inflammation occurs. So we would definitely look at the WBC to see what the leukocyte level was, or the white blood cell level. Stage 2, this is where you have exudate production. In the second stage of inflammation, inflammatory exudate is produced. The term exudate comes from the Latin word meaning to exude or to ooze. Exudate consists of fluid that escapes from the blood vessels, dead phagocytic and tissue cells, and the products they release. The major types of exudate are serous, purulent, and hemorrhagic, which is sanguineous. Serous exudate typically accompanies mild inflammation and presents as clear or straw-colored with a thin, watery consistency. And you do need to know these three terms: serous, purulent, and hemorrhagic. Purulent exudate is usually opaque or milky, commonly referred to as pus. Purulent exudate normally indicates the presence of infection and contains a large quantity of cells and necrotic debris. Because hemorrhagic exudate contains blood from ruptured blood vessels, it is red and thick. This type of exudate leaks from tissues or capillaries as a result of infection or injury. Exudate that appears over a larger surface or in conjunction with other symptoms such as fever warrants a greater degree of medical care. So you need to notify the physician, and you can also have a drainage called serous sanguineous, and serous meaning it's got that clear drainage along with the bloody drainage in it as well. Stage 3, we've got regeneration and replacement. The third stage of the inflammatory response involves the repair of injured tissues by regeneration or replacement with fibrous tissue or scar formation. Regeneration is the replacement of destroyed tissue cells by cells that are identical or similar in structure and function. Damaged cells are replaced one by one, and new cells are organized so that the architectural pattern and function of the tissues are restored. The ability to regenerate cells varies considerably from one type of tissue to another. For example, epithelial tissues of the skin and the digestive tract and respiratory tracts have a good regenerative capacity as long as their underlying support structures are intact. The same is true of osseous, lymphoid, and bone marrow tissues. Tissues that have little regenerative capacity include nerves, muscular, and elastic tissue. So we see a lot of people that have nerve damage that never get their feeling back, or they're not able to restore it back to what it normally was. When regeneration is not possible, repair occurs by fibrous scar tissue. The inflammatory exudate with its interlacing network of fibrin provides the framework for this tissue to develop. So it kind of overlaps and overlaps and overlaps while it's building. And you have this network of fibrin. It continues to provide the framework. Damaged tissues are replaced with the connective tissue elements of collagen, blood capillaries, lymphatics, and other tissue-bound substances. In the early stages of this process, the tissue is called granulation tissue. You need to know that term, because when you're assessing wounds, you need to be able to look at the wound and see if the wound has this pink granulation tissue. It's growing new tissue, and we call it granulation tissue. It is a fragile, gelatinous tissue that appears pink or red because of the many newly formed capillaries. Later in the process, the tissue shrinks, the capillaries are constricted, even obliterated, and the collagen fibers contract, leaving a firmer, fibrous tissue. This is called cicatrix or scar tissue. And so some of us have bigger scars than others, depending on the rate and the amount of fibrin that is released. Mediators of inflammation. The process of inflammation is initiated by the release of mediators from inflammatory cells such as macrophages and mast cells. Mast cells are leukocytes found in most tissues of the body, including the skin, respiratory system, and intestines. They are one of the principal sources of cell-derived mediators of inflammation, including histamine and heparin. See Table 10-1 on 671. So you have bradykinin, complement, histamine, leukotrienes, and prostaglandins. In response to injury or contact with an antigen, histamine and heparin work together to increase blood flow to the injured site. Histamine causes dilation of nearby blood vessels and increases their permeability, while heparin prevents blood clotting. This combined action allows blood to easily enter the affected tissue, resulting in the redness and swelling associated with inflammation. The four types of histamine receptors are H1, H2, and H3, and H4. Of these, H1 and H4 receptors are involved in the inflammatory process. H1 receptors are primarily found on smooth muscles, on the endothelium, and in the central nervous system. Stimulation of these receptors results in vasodilation, bronchoconstriction, pain, itching, and hives, so like an allergic reaction. H4 receptors located in the peripheral WBCs and mast cells are also involved in immune response. Antihistamines block histamine receptors on the tissues, thus reducing the effect of histamine and the resultant allergic symptoms. When a patient is exposed to an allergen that results in a rapid release of inflammatory mediators, anaphylaxis occurs. If left untreated, anaphylaxis may lead to death caused by airway obstruction or vascular collapse, and anaphylaxis is a medical emergency and the person needs to be treated immediately. The most common triggers of anaphylaxis are food, such as peanuts, shellfish, milk, and eggs, insect stings, medications such as penicillin, anesthetic agents, and non-steroidal anti-inflammatory drugs. And look on at the top, it says box 10-1, and it gives you the definition of anaphylaxis. It is a life-threatening allergic reaction that develops extremely rapidly in seconds to minutes and requires immediate initiation of the emergency medical system in out-of-hospital settings. In healthcare facilities, the nurse will initiate the treatment immediately and call for rapid response team. Signs and symptoms of anaphylaxis are inflammation of the airway, swelling of the throat, which can become severe enough to cause a blockage, wheezing, labored breathing, abnormal heart rate, low blood pressure, weakness, lightheadedness, dizziness, nausea, vomiting, or diarrhea. Cyanosis due to increased tissue oxygenation or pallor secondary to shock, hives, and itching. Epinephrine is the first line of treatment for anaphylaxis reactions. Epinephrine dilates the airways and narrows the blood vessels, essentially counteracting the allergic response. While the intramuscular route is preferred, epinephrine may also be administered sub-Q or IV. For intubated patients in whom no other option is available, epinephrine may be administered via the endotracheal tube itself. Some individuals with allergies carry self-injectors with epinephrine, such as EpiPens, to use in case of an anaphylactic response. In the event of an anaphylactic reaction, EMS should be called even for patients who carry and use the EpiPen. During and immediately following the anaphylactic response, airway protection is critical. So adjunctive medications may include beta and agonists, antihistamines, and corticosteroids to help reduce the inflammation. A severe reaction resulting in laryngeal swelling sufficient to close the airway may require the person to be prepped for a tracheostomy. So, alterations involving inflammation. Inflammation can occur in virtually any tissue, organ, or system. Many autoimmune disorders involve the inflammatory response and result from the body's misinterpreting its own tissue as harmful and needing to be destroyed or limited. Rheumatoid arthritis, systemic lupus erythematosus, or SLE, Guillain-Barré syndrome are just a few examples. Additional disorders that involve inflammatory component are allergic rhinitis, anaphylaxis, ankylosing spondylitis, appendicitis, asthma, osteoarthritis, contact dermatitis, Crohn's disease, gallbladder disease, inflammatory bowel disease, nephritis, peptic ulcers, and ulcerative colitis. So you see a lot of things can cause this response to occur. Just so many of these conditions make the person susceptible to inflammatory responses. Inflammation carries implications for nursing care in a number of areas. Patients with mild alterations, such as a sprain, may need simple palliative care, rest, and reminders related to safety and injury prevention. However, infection requires treatment, and the resulting acute inflammatory response may cause additional complications because it's an infection. So, alterations and manifestations. So, what do we see? The classic signs of inflammation include redness and swelling. A healthy inflammatory response includes activation and recruitment of the white blood cells to the affected site. Localized responses are limited in terms of which sites are affected, while generalized responses can affect the entire body. Chronic inflammation of the intestines associated with inflammatory bowel disorder may result in structural changes. For example, Crohn's disease results in fibrotic changes to the bowel wall. Local obstruction, abscesses, and fistulas may develop because it affects the wall and it makes the wall weaker. Malabsorption or malnutrition may result. In rheumatoid arthritis, the chronic inflammatory response affects the lining of the joints and can lead to joint deformity. RA is characterized by pain, swelling, and redness of the joint. Ankylosing spondylitis is a form of arthritis that primarily involves the spine. With this condition, vertebral inflammation leads to severe chronic pain and discomfort. The sacroiliac joints, which are located at the base of the spine where the spine joins the pelvis, are affected by disease progression. In severe disease, new bone formation occurs on the spine, causing spinal processes to fuse into a fixed, immobile position, sometimes creating a forward stoop posture. So what is the prevalence? Who does this affect? Millions of adults and children in the United States have inflammatory disorders. The typical onset of RA, or rheumatoid arthritis, occurs in middle age with an increased incidence among older adults. Rheumatoid arthritis also occurs in children and young adults. An estimated 1.3 million adults, or 0.6% of the population, have rheumatoid arthritis. Ankylosing spondylitis, which primarily affects the spine and the sacroiliac joints, is another debilitating inflammatory disorder. 2.7 million people are affected, and then appendicitis, about 80,000 children or young adults are affected. Genetic considerations and non-modifiable risk factors. Before I get to that, I want you to look on page 673, and here are the alterations and therapies of inflammation. You have pain, and you have edema, heat, impaired function, altered oxygenation, so the site may look pale, it may look cyanotic, and the person may, when they're breathing, cause them to be cyanotic because they're not breathing well, and infection. And so on this chart, you see the interventions and the treatments for pain, NSAIDs, analgesics, heat, ice, edema, elevation, diuretics, heat, antipyretics, cool packs, impaired function, analgesics, physical therapy, and even list dialysis for impaired function. Altered oxygenation. We treat the underlying condition, administer oxygen, bronchodilators, encouragement of it, telling them to cough it up, and monitoring the ABGs. And infection, antibiotics, adequate sleep, fluids, rest. And so when you're assessing your patient, you want to look for pain, edema, heat, impaired function, oxygenation, signs of infection, that heat, redness, swelling, the patient don't want you to touch it. It hurts. So our genetic considerations. Genetic considerations and risk factors vary depending on the nature of the inflammatory disorder. Native and Mexican Americans are at increased risk for gallstones. Family history and female gender are also associated with increased risk. African Americans are more likely than Caucasians to develop nephritis as a complication of systemic lupus and tend to develop nephritis earlier in the course of the disease. Family history is also associated with peptic ulcer disease, although diet and other modifiable risk factors typically are involved. Rheumatoid arthritis occurs among individuals of all races and ethnic groups, and so there's no distinguishing identifier for rheumatoid. It can affect anybody. Concepts related to inflammation. This is on page 675. Immunity, infection, mood and effect, oxygenation, and safety. And so for immunity, you have a foreign substance activates the immune response. And so you want to look for the signs and symptoms of anaphylaxis, hives, itching, alterations in skin color, airway constriction, weak and rapid pulse. For infection, heat, swelling, pain, elevated white blood cell count, mood and affect, mood swings. These patients, they're very uncomfortable. It's uncomfortable to have swelling from inflammation. Corticosteroids, which many people with inflammation may be prescribed, may cause mood changes, euphoria, depression, or severe mental instability. So your mood can be affected by certain corticosteroids as well. Of course, oxygenation. We want to oxygenate, look for those signs of coughing, wheezing, dyspnea, and chest tightness. And then safety is if corticosteroids are abruptly stopped, adrenal insufficiency and crisis may occur with profound hypotension, tachycardia, and other adverse effects. So teach the patient not to stop these medications quickly without consulting the physician. Health promotion. Preventing excessive inflammatory response generally involves avoidance. Individuals with hypersensitivity should avoid known triggers, dust, pollen, animal dander. Individuals with irritable bowel syndrome and peptic ulcer disease should avoid foods or beverages that trigger inflammation. Hand hygiene is a primary method of preventing infection that can result in inflammation. Modifiable risk factors. For Crohn's disease, ways to lower the risk of triggering a flare-up include a diet low in refined sugars, increase fiber intake, and stop smoking. Gallstone formation risk can be lowered by maintaining an appropriate weight, consuming a diet high in fiber and low in fat, and avoiding rapid weight loss. There are several risk factors for nephritis, including diabetes mellitus, hypertension, overuse of NSAIDs, and drug abuse. Patients with diabetes or hypertension can reduce their risk by following their treatment protocols, including maintaining a healthy diet. While consumers have been told that a low-fat diet is a healthy diet, experts suggest that healthy fats are a necessary part of a healthy diet. Remember, I said before, we got to have so much fat to give us some energy. And replacing the fats in low-fat foods with carbohydrates can result in blood glucose elevation. Food intolerances, which are different than food allergies, can result in inflammation appearing in various bodily systems, such as skin problems, headaches, joint pain, weight gain, and so forth. To identify what foods are causing inflammatory responses, a patient may try to keep track of foods in a daily diary and may need to have blood work completed to identify the source of food intolerance, such as like allergy testing to see what kind of foods you're allergic to. Whole food categories such as omega-3 fats, slow digested carbs, antioxidant-rich foods, probiotic foods, and supplements and spices and herbs are highly recommended to prevent inflammation. Some of the specific foods that are recommended for preventing inflammation include nuts, soy, dark green leafy vegetables, tomatoes, garlic, onion, tart cherries, berries, ginger, turmeric, healthy fats, beets, olive oil, and whole grains. So a good list here. As you see, here's some things that you can recommend to your patients, and like spices and herbs and these olive oils and things like that. You can recommend they use those for cooking and seasoning as well. So what are our screenings? The goals of early identification and treatment of inflammatory diseases includes reduced mortality and effective management of the disorder. For many acute disorders that have an inflammatory component, such as appendicitis, screening is not possible because appendicitis happens over time. It happens quickly. Usually by the time you have the symptoms, you got appendicitis. However, for some conditions, such as allergic rhinitis, skin testing identifies the allergens that trigger an inflammatory response. A thyroid-stimulating hormone test determines if an asymptomatic patient has Hashimoto's thyroiditis. So what is our nursing assessment? During assessment, the nurse obtains the patient's history, conducts the physical assessment, and gathers laboratory data. Assessment for inflammation, which can affect any of the body's tissues, is guided by the area of the body involved. Observation and patient interview. Prior to conducting the patient interview, the nurse must make observation of the patient's current condition. This observation should include assessment of the skin, the scalp, the eyes, the presence or absence of discharge or inflammation, the signs and symptoms of an elevated temperature, including but not limited to shivering, sweating, or complaints of feeling too warm, and signs and symptoms of respiratory difficulty, such as elevated respiratory rate, a call for wheezing, or shortness of breath. In addition, the nurse should observe the patient for signs or symptoms of pain, such as the patient's facial expression, or indications that the patient is unable to remain comfortable in the chair or bed. These observations provide data with which to then conduct the patient interview. When taking the patient's medical history, the nurse assesses the degree to which the patient is at risk of developing inflammation and any patient reports that suggest the presence of inflammation as well. Questions to ask as part of the interview. Do you have any pain? If yes, assess the pain for location, intensity, type, severity, current treatments, and effectiveness of treatment. Are you taking any anti-inflammatory medications such as aspirin or ibuprofen, or medications for chronic conditions? Have you had any recent diagnostic procedure or therapy that penetrated your skin or a body cavity? What past surgeries have you had? How would you describe your eating habits? Do you eat a variety of foods? Do you take vitamins or dietary supplements? On a scale of 1 to 10, how would you rate the stress you have experienced in the last 6 months? Have you experienced any loss of energy, loss of appetite, nausea, headache, or other signs associated with specific body symptoms, difficulty urinating frequency, or a sore throat? So these are very specific things that we need to focus on. And again, you have these specific questions that you need to ask, again, like the pain, the anti-inflammatory medicines, like surgeries. But how did you do during the surgery? Did you have a response to any of the medicines that they gave you? The physical assessment. Physical assessment of the patient involves a focus on either localized inflammation or more diverse symptoms. Localized inflammation requires assessment for localized edema, pain or tenderness with palpation or movement. redness or palpable heat at the inflamed area, and reduced or absent function in the body part involved. Conditions causing more widespread inflammation, such as nephritis or allergies, may cause diverse symptoms. Systematic manifestations of inflammation include an oral temperature greater than 38 degrees Celsius or 100.4 or less than 36 degrees Celsius, 96.8. Pulse greater than 90 beats per minute, respiratory rate greater than 20 per minute, tachypnea, and WBC greater than 12,000 or greater than 10% of the bands. So you got some specific diagnostic tests. Now we have some specific tests here that actually look at inflammation. A primary laboratory test ordered to detect the presence of inflammation is the erythrocyte sedimentation rate, or ESR, which measures how far the erythrocyte settles in a tube over a given period of time, usually 1 hour. Normal sedimentation rate is 0 to 15 millimeters per hour for men and 0 to 20 millimeters per hour for women. The sedimentation rate may be slightly elevated in older adults. When an inflammatory process is active, the increased proportion of fibrinogen causes red blood cells to stick to one another and settle faster, causing a higher reading. Another important diagnostic laboratory test is C-reactive protein, or CRP. It is a protein found in the blood that is produced by the liver and fat cells in response to the inflammatory process. In the absence of liver failure, a rise in CRP levels indicate an inflammatory process somewhere in the body. CRP can be used to evaluate the effectiveness of treatment for inflammation. Research also indicates that the CRP can be used to assess risk for cardiac disease, as if it elevates in response to arterial damage. A WBC count with differential may be ordered to determine the presence of an infection. Serum protein electrophoresis may reveal increased gamma globulin and decreased albumin, indicating systemic lupus. And routine chemistry panels may reveal kidney involvement, abnormal liver function, or increased kidney enzymes if the muscle is involved. So you have some very specific labs here that you have to look at here. So what are our independent interventions? Antipyretics may be used if fever is involved, and anti-inflammatory medications are used as appropriate. Other causes of inflammation necessitate other more specific treatments. For example, antibiotics may be required to treat inflammation caused by infection, and steroids may be indicated for severe systemic inflammation. Patients who are prescribed antibiotics and/or oral steroids will require medication teaching to ensure appropriate management of the treatment. So you got to teach them about the medicines. Take all the medicines. You may have to take this medicine with food. This antibiotic may cause diarrhea. Nurses working with patients facing surgical interventions need to emphasize the preparations before surgery and what to expect postoperatively. Perioperative care has to be covered by the nurse very carefully, so you know what to expect during this process. Nurses also need to review dietary intake with patients to be sure they are receiving adequate nutrients to support healing, including adequate protein, carbohydrates, and vitamins. Vitamin C in particular is important in cellular repair. So some of these vitamins really help. Nurses working with patients experiencing inflammation should emphasize the importance of preventing further injury, taking medications as prescribed to treat or prevent illness, and maintaining adequate intake of liquids and nutrients. Family teaching may be necessary if patients need assistance with changing dressings, preventing exposure of the inflamed area to water while bathing, or any other aspect of daily living until the healing occurs. Additional patient teaching during the reparative phase may be necessary to ensure that the patient does not resume activity too quickly and continues treatment until healing is complete and the patient is released by the physician. You got to give it time to heal, and sometimes it takes just a few days and sometimes it takes months. Other independent interventions include those related to alleviating discomfort and reducing inflammation, positioning, applying heat or cold, but make sure you follow the guidelines for heat or cold because they can burn and you need to follow, how you apply it and how many minutes you leave it on there. Promoting coping during healing and recovery, acute or exacerbations for those who have chronic inflammatory conditions. Because sometimes these things can be debilitating and you're out of work, and so you can just be mentally not prepared for that. Collaborative therapies. A chronic inflammatory state is often associated with aging and obesity. These patients may benefit from a balanced diet and exercise, which may require collaboration with a nutritionist and physical therapist. A nutritionist can advise the patient on consuming an anti-inflammatory diet that contains omega-3 fatty acids, antioxidant vitamins, and probiotics, while decreasing consumption of pro-inflammatory foods that contain saturated fats, cholesterol, and a high glycemic index. So we need to stay away from those kinds of foods. A physical therapist can help patients build muscle and muscle strength and increase overall physical health by encouraging exercise and physical activity. The physical therapy can also help patients regain the use of limbs that have been underused because of the loss of function related to inflammation. Because sometimes you may not be able to use that limb until the healing occurs. It's wrapped up, got a dressing on it, that kind of thing. Complementary health approaches. Along with dietary changes, some patients are helped with homeopathic that is effective in lowering inflammation, such as arnica montana. I've never heard of that. Supplements that can help reduce inflammation, such as omega-3 fish oils, flaxseed, vitamin C, E, and D, and an inflammatory plant oil called gamma-linolenic acid. And then mind-body medicine may work as well. So you want to discuss these plans with your healthcare provider before you use them because they may interact with some of your prescription medicines also. Surgery. For example, patients with ulcerative colitis may require surgery to remove the colon and rectum. Patients with gallbladder inflammation caused by recurrent gallstones or other conditions may undergo a cholecystectomy or gallbladder removal. Patients with severe infection and inflammation of extremities may require amputation of the damaged part to avoid life-threatening sepsis. When a patient's condition is treated with surgery, the nurse is responsible for pre- and post-operative care and patient teaching. So we do a lot of patient teaching. Pharmacologic therapy. So what kind of medicines are we looking at? They're aimed at reducing the inflammatory response and reducing pain associated with symptoms of the inflammation. Common medications are NSAID. These are your non-steroidal anti-inflammatory drugs, which have fewer adverse effects than the more powerful anti-inflammatory corticosteroids. NSAIDs, in addition to their anti-inflammatory actions, are also analgesics and antipyretics that help not only reduce inflammation but minimize its effects because the antipyretic is a fever reducer. Corticosteroids are normally administered when inflammation is more severe or is life-threatening, and their use must be managed carefully. And you see this during like anaphylactic reactions, things like that. Make sure you review box 10-2, management of corticosteroids, okay? Because there's some valuable information in there. Make sure that you read over that. Because look at some of the side effects. If it's given by mouth for long-term use, you can, like for cataracts, hyperglycemia, increased risk of infections, osteoporosis, and the more, and I don't think I've said this before, but the longer you've been on corticosteroids, it can reduce your ability to have strong bones, and your bones become weak and brittle, and you can have a lot of fractures while you're on corticosteroids as well. So box 10-2, page 678. So lifespan considerations. Before we move to that, on page 679, here are your medications. aspirin, Celebrex, ibuprofen, naproxen. Yes, I would review those because they will be test worthy. Okay, make sure, because these are the most common ones that we give. All right, and then in our corticosteroids, bechamethasone and dexamethasone, hydrocortisone, methylprednisone, prednisone. Make sure you review these two boxes. These can be up for grabs on the test as well. Okay. Other opioids, they just give these for pain, and then your natural therapies, fish oils and omega-3s, I would know that as well too. But please read over this, especially the nursing considerations. And, do I take it with food? Do I not take it with food? What's it contraindicated in? Again, NSAIDs and glucocorticoid categories, page 679. Lifespan considerations, and I'm sorry I hit the slide too fast, but I'll catch up, okay, with the children. Inflammation in children and adolescents. In pediatric patients, structural differences in the airway increase the risk for obstruction, especially in the event of airway inflammation. In comparison to adults, children have a larger tongue relative to the oral cavity, decreased airway muscle tone, a shorter epiglottis, a more anteriorly positioned larynx, a shorter and narrow trachea, and prominent adenoid and lymphoid tissue. These differences are especially evident when the child is supine or lying flat. So you can hear them, they snore, and they snore loud. These differences are noticeable again when the child is supine, because the child's proportionate larger head and occipitate compared to those of adults. Hyperflexion of the neck further narrows the airways. Fewer and smaller lung alveoli equate to a reduction in the surface area available for gas exchange in children. In addition, the decreased elastic recoil pressure of the alveoli increases the risk of alveolar collapse during respiratory distress. The increased energy needed to achieve adequate oxygenation during airway inflammation or anaphylaxis may lead to fatigue and respiratory failure in infants and in children. Glomerular filtration, as well as the kidney's ability to dilute and concentrate urine, is not fully developed in infants. As a result, the infant's renal system is less capable of compensating for fluctuations in fluid volume other than the adults. Because of the small size of the child, volumes of fluid loss represent a larger proportion of the total body fluid. For example, a 1 liter fluid loss in a 30-pound child represents 7.3% dehydration, whereas the same fluid loss in a 180-pound man is only 1.2%. Changes in excitation, contraction, coupling, left ventricular mass, and the high contractile state of the heart reduce the pediatric patient's sympathetic nervous system responses to changes in blood volume and stress. While adults typically respond to hypovolemia with a compensatory increase in heart rate, tachycardia often is a late symptom in children with hypovolemia. GI inflammation that reduces nutrient absorption affects children more than adults. Children have higher metabolic rates and generally have less stored fat, so decreased absorption of nutrients have more immediate detrimental effects on growth, body weight, energy levels, bone and muscle strength, and overall health. The child's immune system response to insult differs significantly from that of an adult. In pediatric patients, macrophages are more responsive to pro-inflammatory molecules, increasing the production of additional inflammatory mediators. In addition, infants are less able than adults to produce anti-inflammatory mediators. So, when you're having these responses in children, it's very dangerous. It can affect them a lot faster than it can adult. Continuing children and adults, they're too young to understand the implications of assessment of internal organs, so we want to use less invasive techniques. We want to interpret negative blood tests with caution. Often children with inflammatory disorders have normal tests, but that doesn't mean there's not something going on. Again, it's just like with the thyroid. You can have normal thyroid tests but still have a thyroid problem. If visualization is necessary, ultrasound is used instead of endoscopy. And then inflammation can also be associated with other illnesses as well in the children. Pregnant women, physical activity by obese mothers may reduce inflammation during pregnancy. They need to get up and move around. Preeclampsia associated with alterations in inflammatory response to postpartum. So, a lot of times if you're obese, you are dealing, with some blood pressure issues because of the obesity, you may be in jeopardy. Impaired inflammatory response due to chronic anxiety among many African American women may contribute to race disparities in pregnancy outcomes. And then pregnancy associated with inflammation of your gums as well. And then inflammation considerations with the older adults. And so what you will see with the older adults, inflammatory markers, C-reactive protein, IL-6, TNF may be increased in older adults and individuals who are obese. Both of these states are associated with a low-grade pro-inflammatory condition. This increase in inflammation may not be linked to a specific disease such as gallbladder, asthma, or irritable bowel, but instead is an indicator of poor overall health that makes these individuals more susceptible to chronic illnesses and cognitive decline. And so these patients with older adults have other things. They have comorbidities going on, so we need to rule out all of these things. Okay, thank you.